NCLEX practice exam with answers. Full test review. Question 1. A 12-year-old child, admitted with a broken arm, is waiting for a scheduled surgery. The nurse finds the child crying and unwilling to talk. What would be the most appropriate initial response by the nurse? Option A. Reassure the child that the surgery will go fine with no problems. Option B. Provide privacy with encouragement to work through feelings. Option C. Distract the child with a choice of activities to do while waiting for surgery. Option D. Make arrangements for friends to visit as soon as possible. The correct answer is option B. Provide privacy with encouragement to work through feelings. 2. Question 2. A nurse is caring for a client with a sigmoid colostomy. The client requests assistance in removing the flatus from a one-piece drainable ostomy pouch. Which intervention should the nurse use? Option A. Pierce the plastic at the top of the ostomy pouch with a pin to vent the flatus. Option B. Pull the adhesive seal around the ostomy pouch to allow the flatus to escape. Option C. Open the bottom of the pouch to allow the flatus to be expelled. Option D. Assist the client to ambulate to reduce the flatus in the pouch. The correct answer is option C. Open the bottom of the pouch to allow the flatus to be expelled. 3. Question 3. A client returns from the operating room after a right orchiectomy. What is the priority nursing intervention during the immediate postoperative period? Option A. Manage postoperative pain. Option B. Maintain fluid and electrolyte balance. Option C. Control bladder spasms with PRN medication. Option D. Ambulate the client within a few hours after surgery. The correct answer is option A. Manage postoperative pain. 1. Question 4. The nurse enters the room of a postpartum mother and observes the baby lying at the edge of the bed while the mother sits in a chair. The mother states, "This is not my baby, and I do not want it." How should the nurse respond? Option A. What a beautiful baby. The baby's eyes are just like yours. Option B. This is a common occurrence after birth. Let's talk about how to accept the baby. Option C. You seem upset. Tell me about how you are feeling. Option D. Many women have postpartum blues and need some time to love the baby. The correct answer is option C. You seem upset. Tell me about how you are feeling. 3. Question 5. The client calls the clinic nurse and reports nausea, headache, and fatigue. The client also reports seeing yellow halos around lights. What is the best response by the nurse? Option A. Do your eyes appear bloodshot and is there any itching? Option B. Tell me about your prescription for digoxin. Are you still taking the medication? Option C. Call back in a week and schedule an appointment if your symptoms don't improve. Option D. Is there anyone else at home who has the same symptoms? The correct answer is option B. Tell me about your prescription for digoxin. Are you still taking the medication? 2. Question 6. A client is admitted to the mental health inpatient unit with a diagnosis of major depression after a suicide attempt. In addition to expressions of sadness and hopelessness, the nurse anticipates observing which characteristics? Option A. Meticulous attention to hygiene, grooming. Option B. Anxiety, hostility. Option C. Psychomotor retardation, agitation. Option D. Guilt, indecisiveness. The correct answer is option C. Psychomotor retardation, agitation. 3. Question 7. A nurse is assigned to care for a 10-month-old infant with the new diagnosis of anemia. Which of these findings should the nurse anticipate? Option A. Behavior consistent with hyperactivity. Option B. Slow heart rate when sleeping. Option C. Pale mucosa inside the mouth. Option D. High hemoglobin level. The correct answer is option C. Pale mucosa inside the mouth. 3. Question 8. The nurse is assisting a withdrawn client to begin to develop relationship skills. Which nursing intervention should be most effective? Option A. Assist the client to analyze the meaning of behaviors. Option B. Remind the client frequently to interact with other clients. Option C. Offer the client frequent opportunities to interact with the nurse. Option D. Initiate client interactions with one or two other clients. The correct answer is option C. Offer the client frequent opportunities to interact with the nurse. 3. Question 9. A female client admitted for a breast biopsy says tearfully to a nurse, "If this turns out to be cancer and I have to have my breast removed, my partner will never come near me." What would be the most appropriate response to this statement? Option A. Are you questioning the depth of your relationship? Option B. Why are you concerned that you will be rejected? Option C. You sound worried that the surgery might change your relationship with your partner. Option D. I'm sure your companion will understand. The correct answer is option C. You sound worried that the surgery might change your relationship with your partner. 3. Question 10. The client is diagnosed with asthma. What information should the nurse reinforce that the client should monitor on a daily basis? Option A, peak airflow volume. Option B, respiratory rate. Option C, pulse oximetry. Option D, skin color. The correct answer is option A, peak airflow volume. 1. Question 11. A nurse is providing home care for a client diagnosed with chronic heart failure and episodes of pulmonary edema. Which nursing diagnosis should the nurse expect as a priority in the plan of care? Option A, activity intolerance related to an imbalance of oxygen supply and demand. Option B, imbalanced nutrition related to poor appetite. Option C, risk for impaired skin integrity related to dependent edema. Option D, constipation related to reduced activity level. The correct answer is option A, activity intolerance related to an imbalance of oxygen supply and demand. 1. Question 12. The nurse has been reinforcing information about cardiac risks to adult clients when they visit the hypertension clinic. What would be the best way to determine if learning has occurred? Option A, performance on written tests. Option B, completion of a mailed survey. Option C, responses to verbal questions. Option D, reported behavioral changes. The correct answer is option D, reported behavioral changes. 4. Question 13. The nurse is caring for a postoperative client. What is the priority nursing intervention the nurse will reinforce for preventing atelectasis? Option A, turn, cough and breathe deeply. Option B, ambulate client within 12 hours. Option C, maintain adequate hydration. Option D, splint incision when moving or coughing. The correct answer is option A, turn, cough and breathe deeply. 1. Question 14. A nurse is working with parents to plan home care for a toddler with a heart problem. What should be the priority nursing intervention on the plan of care? Option A, assist the parents to plan quiet play activities with the toddler at home. Option B, stress to the parents that they will need relief caregivers. Option C, instruct the parents for them and the toddler to avoid contact with persons with infection. Option D, encourage the parents to enroll in child cardiopulmonary resuscitation, CPR, class. The correct answer is option D, encourage the parents to enroll in child cardiopulmonary resuscitation, CPR, class. 4. Question 15. A client becomes acutely short of breath with an SpO2, oxygen saturation, of 82%. Which oxygen delivery system should the nurse apply that would provide the highest concentrations of oxygen to the client? Option A, simple face mask. Option B, partial rebreather mask. Option C, Venturi mask. Option D, non-rebreather mask. The correct answer is option D, non-rebreather mask. 4. Question 16. A nurse gathers data related to delayed gross motor development in a 3-year-old client. Which observation by the nurse should confirm this finding? Option A, cannot ride a bicycle. Option B, cannot catch a ball. Option C, cannot skip on alternate feet. Option D, cannot stand on one foot. The correct answer is option D, cannot stand on one foot. 4. Question 17. A client is admitted to the hospital with a history of confusion. The client has difficulty remembering recent events and becomes lost when outside of the home. Which statement would provide the best reality orientation for this client? Option A, hello, my name is Elaine Jones and I am your nurse for today. Option B, good morning, you're in the hospital. I am your nurse Elaine Jones. Option C, how are you today? Remember, you're in the hospital. I will be your nurse all day. My name is Elaine Jones. Option D, good morning, I am Elaine Jones, your nurse. Do you remember where you are? The correct answer is option B, good morning, you're in the hospital. I am your nurse Elaine Jones. 2. Question 18. A client is diagnosed with a salmonella infection. What is a primary nursing intervention to be taken to minimize the transmission of disease from this client? Option A, double glove when in contact with feces or emesis. Option B, wash hands thoroughly before and after any client contact. Option C, wear gloves when disposing of contaminated linens. Option D, use gloves when in contact with body secretions. The correct answer is option B, wash hands thoroughly before and after any client contact. 2.